think we are live.
Showtime.
Yep, perfect. Happy New Year, everyone, and welcome to day 6 of Thriving in the Face of Cancer. I'm your host, Chef AJ, and for the next 26 days, I'll be talking to top doctors and other healthcare professionals, as well as people who have survived cancer, who will be giving insights on how you too can thrive even in the face of cancer. Today's guest is a legend who needs no introduction. He is known as the father of lifestyle medicine. Please welcome Dr. Dean Ornish. Thank you so much for being here, Dr. Ornish. I cannot tell you how grateful I am.
Me too. Thank you.
Yeah. Well, Dr. Ornish, I mentioned to you before going live that I get a little bit nervous around you because I do think that you're kind of a big deal in the world, and especially, the godfather of lifestyle medicine. All your books have been national bestsellers, many of them, including 4 of them, #1 New York Times bestsellers. I have almost all of them. And, I feel like, even before I discovered Barbara Rolls, you kind of wrote the book on calorie density, first person to reverse heart disease. But I do have to say that of all your books, my favorite remains Love and Survival. And that's why I wore my heart shirt today, because what I love about you the most is I feel like you're pretty much the only plant-based doctor that has ever talked about love and how it really is a healing factor. And if it's not one of the pillars of lifestyle medicine, it should be. We always say it's the food, and the food is important, but it's not just the food. And I really appreciate how that has always been something that you've believed in.
Yes, it's true. It's my favorite book as well, and one that people say, okay, we're talking about eat well, move more, stress less, and love more. And people say, okay, I get to eat well, and the move more, sure, I got to exercise and eat well, move more, stress less. Okay, meditations, or maybe I haven't done that before, but I'll give that a try. But what's that love more part? What does that mean? And what it means is that. Uh, and by the way, I'm very grateful to the Surgeon General, Vivek Murthy, who's been a longtime friend, who's taken these and has really emphasized how important love and intimacy are as part of our healing. Even the word healing comes from the root to make whole. Yoga is from the Sanskrit to yoke, to unite, union. These are really old ideas that we're rediscovering. And study after study has shown that people who are lonely and depressed and isolated are 3 to 10 times more likely to get sick and die prematurely than those who have a sense of love and connection and community. And there's been a radical shift in our culture in the last 50 or 60 years. When I was growing up, we had an extended family we saw regularly. There was people had a job that they'd been at for 10 years or more, got to know their coworkers. They had a church or synagogue or a club or something they went to regularly. They had a neighborhood with 2 or 3 generations of people who grew up together. And many people today don't have any of those. You say, well, that's just life, so what? Well, the best thing about growing up or being in a community of people is that they know you. They don't just know you as Chef AJ, the world famous chef. They know you, or when I was growing up, they would know me as the guy who, whatever, broke a window with a baseball, or somebody else might have gotten busted, or somebody else, may look like the perfect father, but you know that they're not, but they're still there for them. And there's just something really primal about being fully seen and accepted, not just for your good stuff, but for all of you. I mean, James Cameron in the Avatar film says, I see you, which is really from an African proverb. I see all of you, and I accept all of you, even though there are parts of you I may not like, I can still love all of you. And that sense of unconditional love and acceptance is really powerful. One of the studies that my wife Ann and I wrote about in our Undo It book, and we've been working together now for almost 30 years, was a study that that the more time you spend on Facebook, the more depressed you are. Well, why would that be? Because it's not a real intimacy. People don't post their dark side and demons, you being a notable exception to that, which is what I'm here. I talk about myself a lot for the same reason, to shine a light in that darkness. But the idea is that most people, don't talk about that. And so it looks like everybody on Facebook has this perfect life but you. And it's like, here we are in front of the Louvre, and here we are with our perfect kids in graduation and so on. And so part of what I've learned is that there is this radical shift in our culture, and we can do something about it. And because one of the things that happens when you view yourself as being separate and only separate is that it's like, I must be lacking something or I wouldn't feel this way. If only I had more, whatever, more money, more power, more sex, more beauty, more accomplishment, those are the usual things in our culture, then I'd be happy. Then people would love me. Then I wouldn't feel so lonely and isolated. Now, once you set up that view of the world, however, it turns out you're likely to feel worse because until you get it, you're really stressed. And we invest these things with a sense of like, it's like, am I not only going to, it's like my survival in many cases feels like it's on the line there. Until we get it, we're stressed. If someone else gets it, we're even more stressed. And it reinforces that we live in this kind of dog eat dog world. And even if we get it, it's great for a moment. It's like, now I'm happy. But it usually doesn't last very long. It's like soon followed by either now what, it's never enough, or so what, big deal, it doesn't provide that lasting sense of meaning. And so the cycle continues. Well, this didn't do it, that would. One patient told me I always got a dozen projects going at the same time, so I can immediately shift my focus from that disappointment to, well, maybe this didn't, but that will. So when someone is, part of the reason that I do these research studies is that they're hard to do. Everything we've done, people thought was not true at the time. And when you're trying to get funding to do studies for things that people think are impossible, it's challenging because without the funding, you can't do the study. And if they don't think it's going to work, then they don't want to fund it. So we just generally just do it and raise the money as we go along. But the reason why, even though they're hard to do, these studies are worth doing is they bring me a sense of meaning in my life. When I was 19, I learned I could take all the meaning out of my life and became suicidally depressed and almost committed suicide. That was my turning point. For someone else, it might be a diagnosis of cancer like you're experiencing, or many others are, or a heart attack, or loss of a job, or some event that takes us out of our daily kind of status quo. And while we don't look for suffering, I learned that I could take all the meaning out of life, but I also learned that I could imbue my life with meaning. And for me, it was through relationships and acts of service. So the most selfish thing I can do is help somebody else because it provides me a sense of meaning. And so many of the best healers are wounded healers in that sense, that they come from that place where they really have that compassion from their own suffering. And being able to invest meaning into your life is what makes it bearable, I think. Viktor Frankl wrote that classic book, Man's Search for Meaning, that the people who survived the concentration camps weren't the healthiest or the strongest. In general, they were the ones who had the strongest sense of meaning and purpose. I have to survive so that I can be reunited with my loved ones or bear witness or whatever it is. And so I think that without in any way trivializing the experience of being diagnosed with a life-threatening illness, there is sometimes something there that can be meaningful because it gets our attention. Even then, within a few weeks, sometimes people try to go right back to what they were doing. But there is that motivational moment, that transformative moment, really, where if guided properly at the time, because change is hard. But if you're suffering enough, then the idea of change becomes more appealing. It's kind of like, wow, that's kind of either too weird or too hard. That's so weird, meditating or doing yoga or eating plant-based food or loving more, but I don't know, I'm hurting so bad. Let me try this weird stuff. And then when they do, first of all, generally people feel better in ways that really matter to them. So that brings that sense of meaning, which just feeds our soul. But also purely from a biological standpoint, these biological mechanisms that control our health and well-being are very dynamic. You can get better quickly and you can get worse quickly. And so for many people, they say things like, having a heart attack was the best thing that ever happened to me. And I would, of course, if I ever said that to someone, they should punch me. But from them to say it, I said, well, the first time I heard that, I said, well, what does that mean? They said, well, it got my attention. I transformed my life in ways that have made it so much more joyful and meaningful. My relationships with my friends and family are so much better. My loved ones, I'm feeling better. My engine is gone. I never would have, this never would have happened to me otherwise. So while we don't look for bad things to happen, sometimes, there they are. So now what? So if we can find that sense of meaning and purpose in it, then sometimes we can redefine that experience.
It's funny that you mentioned Viktor Frankl's book, because other than your book, Love and Survival, that is one of my favorite books of all time, Man's Search for Meaning. Yeah.
Yeah.
I just want to express how grateful I am of the email you sent me. So I knew about the tumors in my lung and liver since August of 2023, and I saw you at the Plantrician Conference in September of 2023, and I wanted to go up and talk to you. You actually had a line of people, and I chickened out. Then I saw you again in September of 2024, because I hadn't gone public yet, and I chickened out again. And then somebody said, just email him. So I sent you an email because my concern was, I wanted to be transparent because I think the old saying, a burden shared is a burden halved, is so true. And I felt like I just was just so fake and phony and lying about this, going live every day and smiling when inside I was dying. And I sent you an email, and the email you sent me back was the kindest. I mean, that email literally like saved my life because it gave me it took it just well, first of all, it gave me the courage to go public when you shared about how there are people that follow the diet for reversal of heart disease perfectly and still have a heart attack.
Yeah.
And there's so many people. I mean, vegans are some, I gotta say, they're some of the most judgmental people in the world. And I've been one for 50 years. And, the first thing, when I tell people I have lung cancer, did you smoke? Even if I did, that's not the kindest first line to say. And one of the reasons that I'm using this platform is to give awareness that anybody that has lungs can get lung cancer. And lung cancer is on the rise, not only in non-smokers, but in young people. And it is the least funded, most stigmatized cancer. But the email, I just like when I need support or encouragement, I just read that. It just was like so kind. And just the fact that, because I think of you as kind of a big deal and that you would take the time to write me and the things you said. And I'd love for you to speak to the fact that even with lifestyle medicine, people can get sick.
Yes. Well, first of all, you're a big deal. Everyone is a big deal. I love Margaret Mead once said, "You are unique, but then so is everyone." So we're all looking for our
That's a
path.
great line.
Um, but to me, authenticity is really the basis of healing because you can only be intimate, and intimacy is the basis of healing. As I talked earlier, to make whole, to bring together. And when we can only be intimate with each other to the degree that we feel safe. We can open our hearts and be vulnerable. But we've all had experiences where we open our hearts and somebody hurt us. And so that wall around the heart says, hey, you need me for your survival. And we do need it. But we don't, the problem is not that we want to open our hearts to everyone, but rather we want to have at least someone or somewhere that feels safe enough to do that. That to me is where the idea of a committed monogamous relationship comes from, not out of a sense of morality, but a sense of, oh, I can really be safe. Intimacy isn't just, binary. It's not like you have it or you don't. It's infinite levels of intimacy. And the more intimate it is, the more erotic it is, the more pleasurable it is, the more healing it is. And so when you came forth to speak authentically about your diagnosis and your journey, it enabled everyone to trust you fully. And that makes listening to you a healing experience because just being in any kind of relationship with someone where you feel safe, where that person is being authentic, even if they're saying things you don't like, but you know that they really believe them, means you can trust them. And trust is really the basis of intimacy. And intimacy is the basis of pleasure as well as healing. People don't realize that. They think the choice is like, oh, I'm going to be in a committed monogamous relationship. It's going to be boring. Am I going to live longer? If I eat a plant-based diet, am I going to live longer? It's just going to seem longer, all those kind of tired cliches. When in fact, there's no point in giving up something that you enjoy unless you get something back that's better and quickly. And when you make these changes, you feel so much better, but not just physically, but on a deeper inner heart level. Your heart can open up, at least if there's one person in your life that you can do that with. It's like what you gain is so much more than when you give up, when you're in that kind of committed relationship. It takes it out of the realm of, a moral issue or you're good or you're bad, or just like with, the same words we use around food, like you're a good person, I eat good food, I'm a bad person, I eat bad food. As you say, vegans can be, tend to see the world in like black and white terms. You're on the bus or you're off the bus. There's no gray area there. I wrote a book called The Spectrum years ago that kind of got a lot of my vegan friends annoyed with me because I
Yep,
put
yep.
a piece of
Got it right
sandwich.
here. But but
Because
what I but let me say what I loved about this book, yeah, is that you talked about how uh, fear is not sustainable. So when you tell somebody they have to change their diet or quit smoking or something bad will happen, you talk a lot about this book is that the joy is what is sustainable.
joy and pleasure and love and feeling good are what are sustainable, just as you say. And we so much of the language around food or behaviors have this kind of nurse ratchet, from One Flew Over the Cuckoo's Nest, finger wagging, you're bad, bad. I mean, I can't go out to dinner. You probably have the same issue without someone either apologizing for what they're eating or commenting what they're eating. But food is just food. But once you call foods good or bad, I'm not talking about the ethical and the abuse of animals and all that. That's a whole important and valid and the effects on global warming and all that. I'm just talking about the language we use right now. And the language, once you call foods good or bad, it's a very small step to saying I'm a bad person because I eat bad food. I cheated on my diet, all these kind of moralistic, judgmental words that are ultimately toxic. And so what I did in the Spectrum book was to say, look, some foods are healthier than others. That doesn't mean they're good or bad. So I categorized them from the most healthy group 1, which is mostly plant-based, whole foods vegan diet, and group 5, which is the more typical American diet, and groups 2 through 4 in the middle, and say, look, if you're trying to reverse heart disease, it's a prescriptive thing. This is what it takes to do it. The reason my colleagues and I were first to show that is that it's hard. You have to make really big changes. Moderate changes may be enough to prevent it in some people, but not usually enough to reverse it. But when you make really big changes all at once, you can often show that. That's what we were able to show using quantitative arteriography and cardiac PET scans and so on, cardiac events and so on. That's why Medicare ultimately ended up covering our program. But if you're just trying to stay healthy, what matters most is your overall way of eating and living. So if you indulge yourself one day, it doesn't mean you failed or you're cheated or you're bad. Just eat healthier the next. You don't have time to exercise one day. Eat, do a little more the next day. I put a piece of salmon on the cover of my book, which really alienated a lot of my vegan friends to say, look, you have to meet people where they are. The perfect is the enemy of the good. If you tell somebody this is the best way to eat, and 95% of people don't want to do that, how helpful is that? Now, I tell people that's the best way to eat, but I also tell people that to whatever degree you make lifestyle changes, there's a corresponding benefit at any age. So if you say, like, I want to get my cholesterol down 50 points, or my blood pressure down 10 points, or my hemoglobin A1C down a couple points, or whatever, lose 20 pounds. I say, what are you eating now? I'm eating mostly unhealthy group 4 and 5. How much are you willing to change? Wow, no one's ever asked me that. They're always telling me what to do, and even more than being healthy, I found people want to feel free and in control. And as soon as I tell somebody, eat this and don't eat that, and do this and don't do that, they want to do the opposite. It goes back to, Adam and Eve, the first dietary intervention that didn't go so well. And so what I say, look, okay, they'll say, I'll eat mostly more groups 1 and 2, but I'll still eat some 4 and 5. Great. How much exercise are you doing? Not much. How much are you willing to do? I'll walk 20 minutes a day. Great. How much meditation and yoga are you doing? 0. How much are you willing to do? I don't know. I'll meditate 10 minutes a day. How much time are you spending with your friends and family? Not much. I'll spend more. Great. We track it. We support it. Again, what matters if they forget to exercise one day, do a little more the next, and so on. They come back in a month. They wanted to get their LDL down 50 points. It went down 30 points. How wonderful. Look how well you're doing. Now, if you go a little bit further on the spectrum of these healthier choices, you'll probably go the rest of the way. So I think getting out of the sense of like, oh, I've got lung cancer. Oh, did you smoke? Like, well, if you didn't smoke, then you feel like people are, judging you. And if you did smoke, you feel like people are blaming you, so that's not good. A better answer would be, what should the second question be after you tell somebody, or what should someone say to you after you tell them that you've got lung cancer?
What I would have liked to hear is like, wow, I'm so sorry. Is there anything I can do to support you? That would have what I would like to hear.
Exactly, because it's our feelings that connect us. We can talk about what is your prognosis, and what stage was it, and all that kind of stuff. And those are important questions if you're really trying to be a doctor and treat you. That's the kind of questions I would ask you if you're a patient of mine. But if you're my friend, I don't want to go there. It's more like, how are you feeling about it? How can I support you? I love you. Life is short. I don't want another day to go by without telling you how I really feel about you. Then something meaningful can come out of that in any way. It doesn't mitigate how painful or horrible or awful it is, but even a small candle can drive out the darkness. And there's a lot of fear around a diagnosis like this, and it brings up inevitably questions of, well, what is the meaning of life? Have I lived the life I want to be living? In whatever time I have left, do I want to keep doing what I'm doing or do something different? Or so, what would that be, and why, and how could I do that? And where around that sense of meaning comes a sense of, what is death? What is life really? There are profoundly spiritual questions that can come up. I was trained as a doctor to kind of dismiss them and bypass, literally or figuratively, the pain that someone's experiencing. But the pain, again, you don't look for it, but sometimes there it is, can be a powerful force for transformation, because it's too painful to not do something, by definition. And so what is that something that people can do? Well, again, coming through whatever spiritual or secular upbringing you have, or whatever search you want to go on, I think it's really important for people, whatever. I mean, when I almost committed suicide, it really I feel like death is always right next to me. And whatever scary part there was, which I don't think I've fully gotten over, um, is the fact that it gives me the courage to do things that I would never have done before. I mean, like I say, all the research studies I've done had people thought was impossible at the time. Well, I figured, okay, well, I almost kill myself. What could be worse than that, right? So what's the worst that could happen? If it doesn't work, I'll learn something. A scientific study isn't judged like if it's good or bad based on the results, but rather, did you do it with integrity? Did you do it, according to the principles of science? And then whatever you find, if you find, like we did this study we published a few months ago in May, showing for the first time that the progression of that cognition and function in people who have early stage Alzheimer's disease can often improve in people after just 20 weeks who make these same lifestyle changes. No one had ever shown that before. They've spent billions of dollars on these drugs. Only 3 have been approved, and they only slow it down a little bit. And they're really expensive, and they have really bad side effects in many cases. So I would never have done that study had I not gone through that experience when I was 19. Because again, I thought, well, even if we show it does nothing, that'll be an important finding too. It'll be disappointing. I hope we can show that we can show improvement, but whatever we show, it'll be important. And so finding that sense of meaning and purpose, that what is it that it feeds my soul and my journey, and getting clear about that. I'm curious to know in you, how would you answer those questions?
Well, there's so many things you said that I resonated with, and one of the first things when you said about, well, if I killed myself, there's still going to be something to learn, and what could be worse than that? And one of the reasons I was afraid to come out was that people would make mean videos about me, like they sometimes do. And they did. I haven't seen them. I've heard about them. But then I said to myself, what could anybody do or say to me that's worse than having cancer? Really? Seriously.
Yeah.
It's kind of made me, I don't want to say indestructible, but I've always been a very sensitive person. But it's like, now, what could you ever say about, how people say like how bad I look and all these things? And it's like, okay, nothing's worse than, I mean, in my world
Wait,
right
wait,
now.
wait, wait. I think you look beautiful.
Well, thank you. No, but people may say mean stuff. I don't know if it's because I'm female or vegan, but I get, I don't read the comments anymore. But I feel like it's made me tougher in a way because, like, what are you going to say that's worse than this? So, take your best shot because, cancer's beating you anyway. So, yeah, I think it's,
I had my spiritual teacher was a guy named Swami Satchidananda, and he said, we're born fine, and then we let others define us. So, but we can take that power back. We don't have to do that. When I was a freshman in college, I took a film course with a guy named Frank Danielle, and he won a couple of Oscars. And I said, but he was a very peaceful guy, and he kind of didn't fit the mold of the stereotype of a kind of a director dealing with his demons. And I went up to him after the class. I said, how come you look so peaceful? He goes, I don't read my reviews.
yeah, absolutely. And I don't anymore. I knew that if I was going to come out, I had to take myself off social media. I still have a presence, but I have people, posting for me and reading the comments because I can't. And they're gathering up the nice ones and telling me, but that's the thing. I've had to really focus on just the positive, and that's really important. Dr. Ornish, what do I say or what do you say to people? Because it's funny because I feel bad that a lot of the other plant-based doctors are being burdened with people saying, well, how did, she's be vegan for 47 years. She ate so perfectly. How'd she get cancer? How do we get them not to throw out the baby with the bathwater? That just because this happened to me doesn't mean that lifestyle medicine and a whole food plant-based diet, low in fat, is not going to work for you because there's so many comments, like for example, to you, like this one on Instagram from a viewer that says, Dr. Ornish, I give you credit so many times. My husband is healthy and robust. He turns 96 in March, from following your program. So I don't want people to think like just because the diet didn't work for this, and maybe it did work because a lot of people are saying that if you have, once they find the tumor, it's been there for a long time. Maybe my diet and lifestyle protected me all these years.
Yeah. Well, let me answer your question on a number of different levels. The first is from a higher level. It's like um, there's a tendency, people are afraid of the unknown. They're afraid of death. I mean, I live in, the Bay Area where all this billions of dollars are now going into longevity research. We actually did, by the way, in collaboration with Dr. Elizabeth Blackburn, who got the Nobel Prize for discovering telomeres, ends of our chromosomes that regulate aging. We showed for the first time that any intervention could actually lengthen telomeres. And when we published it, the Lancet editors called it the first study showing the lifestyle changes may, improve survival, reverse aging at a cellular level. So there's a lot of interest in people wanting to live forever. I'm 71. I mean, I'm feeling better than I've ever felt. But a lot of people, are really worried and fear the unknown. Is like, is dying, going into a black coffin by yourself forever, the ultimate isolating experience, which to me would be a definition of hell. Or is it the river returning to the ocean, the drop of rain returning to the river. My teacher used to say it's kind of like an old time movie theater where the light from the projector goes through the film and then projects all these dramas and names and forms on the screen. But you don't want to forget the fact that it's just a movie, that there's a light going, that it's the same light, that non-dual experience that is manifesting in all these different names and forms and dramas. So from that point of view, I think part of the reason why people want to think that, oh, if I just eat a vegan diet, I'll live forever, is that fear that, and it kind of goes to that kind of black-white duality, is really fear-based. That like if I can just control everything, if I eat the purest vegetables and drink the purest water and meditate for an hour a day and do all these things, I'm going to live forever. Now we know that that doesn't happen, but at some primal level, we just kind of want to kind of keep our fear of death at bay. So what I tell people is, look, nothing works for everybody. There has to be a sense of humility around this. That the fact that smokers get more lung cancer doesn't mean that everyone who smokes gets lung cancer or everybody who gets lung cancer smokes. But it clearly increases your risk a lot. Eating meat clearly increases your risk of all kinds of diseases. Eating a plant-based diet, we showed can reverse the progression of heart disease, type 2 diabetes, high blood pressure, high cholesterol, early stage prostate cancer. We did the first randomized trial showing that lifestyle changes could slow, stop, and even reverse the progression of early stage prostate cancer, which is probably true for some forms of breast cancer. We did that with the chair of urology at UCSF, where I'm a professor, and the then chair of urology at Sloan Kettering, and most recently about early stage Alzheimer's disease. So nobody in the planet has a greater awareness of the power of lifestyle to not only prevent, but reverse in many cases. But not every patient gets better in those studies. We did find, using this rather crude formula that we use in all of our studies, we correlated the degree of lifestyle change with the degree of improvement, whatever we were measuring, whether it's the amount of blockages in the arteries or the length of the telomeres or the PSA levels in prostate cancer or the cognition and function in Alzheimer's. We found that the more people changed their lifestyle, the more closely they followed our lifestyle medicine program, the better they got at any age. I had predicted incorrectly that the younger people with less severe disease would get better, but I was wrong. It wasn't how old or how sick they were. The more they changed, the better they got. But not everybody got better. Not everybody who followed the program got better to the same degree. But on average, that's what we found. But people aren't average. People are, we all are N of one studies, if you will. And so I think we have to approach this to say, yes, there are many things that we can do, but we can't control everything. You might have been on a plane somewhere and, a random ion came through your DNA and hit a critical link there and caused a mutation. I mean, who knows? There are bioplastics in everybody. I mean, there's so many things that can contribute to cancer. Besides, we try to be reductionistic. That's why my program has always had multiple interventions. People would criticize and say, oh, you need to have one independent variable, one dependent variable, keep everything else constant. But you're never just changing one thing in a lifestyle intervention. Even if you think you're just doing like exercise alone, you're giving them a sense of meaning and support and all kinds of other things that you may not be aware of, but they're still occurring. So the idea that if we just change enough things, we can, make ourselves heart attack proof, or cancer proof. I think we can certainly reduce our risk. But ultimately, the mortality rate is still 100%. It's one per person. We're all going to die. And I think that's something we try not to think about most of the time. But I actually think about it all the time because every time I think about it, I can ask myself, am I acting in the way that I want to be acting? I love that movie, Defending Your Life with Albert Brooks. I don't know if
Oh
you ever
yeah,
saw that.
that's the best
Or-
movie. Meryl Streep is hilarious.
yeah, it's like hasn't done much of his life, and she's like Joan of Arc. It's like you have to review your life and see how you did. So I think about that, but more even before that, I just think like when I'm hopefully really old and looking back on my life, but whenever that is, I don't want to have regrets of like, oh gosh, if I make mistakes, I'd rather them be of commission than omission. Because if you make a mistake, if you do something that doesn't work out, there's a lot of wisdom that comes from making mistakes and learning from them if you don't judge yourself too harshly. But if you don't do something, then at the end of your life, you think, gosh, wonder what that would have been like, or maybe I should have been with that person instead of that person or whatever. And so I think that to the degree that it really clarifies our life, again, we can find meaning in it, but we don't want to find blame in it because that presumes that a certain amount of hubris that isn't warranted. We don't know enough to know to blame people.
I love how, you kind of simplify it when you say, eat well, love more, stress less, and move more. I mean, that's kind of it. But you're the only one that talks about stress. I mean, I've had people on this show that were doctors saying stress has no impact on whether or not we get a disease or can recover. I mean, I don't want to be arguing with doctors or any of my guests, but it does have an impact, doesn't it?
Oh, there's a whole literature around that now. I mean, I remember when I was doing my medical residency at Harvard and at Mass General, one of the departmental chairs came up to me. He goes, "You really think the mind affects the body? What a stupid idea." And I looked at him, I said, "Dr. So-and-so, have you ever had an erection?" You know, it's
You're
like,
funny.
you
That's
know,
like,
um, it's just the idea that, it's that old joke, I lost my wallet, but I'm looking for it under the street lamp because the light's better there. It's like, there's such a literature on stress and everything that for someone to say that, it just displays that they're not really up with things. But even with that, we don't want to say, well, I was too stressed or whatever. We can always find reasons to blame, but I'm more about empowering people than blaming them. To say, it's good to rather to say what happened, why did this happen to me? To say, what can I do at this point? Whatever reason it happened to me, what can I do to maximize my chances of healing, of quieting down my mind and body, of experiencing more of an inner sense of peace and joy and well-being, of using this opportunity to tell my friends I really want to spend more time with you. I want to tell you how I really feel about you, and and in relationships that are not feeding my health and my soul and well-being, to stop seeing those people. Literally, and it just there are a lot of things that people can find not only meaning in, but ways of improving whatever time we have left by asking those questions, by keeping death close to you, so that we can be reminded of what really matters and what doesn't.
yeah. So this is funny. Are you familiar with the movie Inside Out 1 or Inside Out 2?
Yeah, yeah.
I love that movie. So I have like all the characters up here on my computer, and the minute you came on the show, this one fell down, and this one is joy. This is joy. Isn't that
Yeah.
funny? Of all the characters, this is what you inspired. I just think it just again, congratulations just on all your success and all you've done for the world in general and the plant-based world. The fact that Medicare pays for your program, that's incredible to me. You
Yeah,
know?
well, that took 16 years. We had the support of Bill Clinton when he was president. And he's been on my program for reversing heart disease. He's talked about it publicly. I wouldn't say anything. We had the support of Newt Gingrich when he was Speaker of the House. We had the support of Charlie Rangel, one of the most liberal Democratic members of Congress, and Dan Burton, one of the most Republican right-wing ones. It's the sort of thing that brings people together. And so I'm encouraged by that. I really think that uh, I used to think if we just did good science, that would change medical practice. And to some degree it did. But I realized that a primary driver of medical practice is reimbursement. We doctors do what we get paid to do, and we get trained to do what we get paid to do. That's why, the average doctor gets 4 hours of nutrition training a year, and the average cardiology fellow gets none, in 4 years of fellowship, because that's not where the money is. And so it's not that doctors are only interested in money. Doctors are wonderful people. But, if you're trained to use drugs and surgery and you get reimbursed for drugs and surgery, that's what you use. And so that's part of been my life mission, is to try to say, yes, drugs and surgery can be life-saving in a crisis, especially, but it's also important to look at the underlying causes of why we got in this position in the first place and how lifestyle can often address that. And so now that Medicare created a benefit category to cover our program for reversing heart disease, that made it available. I didn't want this just to be for, concierge medicine. I wanted, having seen what a powerful difference these changes can make, I wanted it to be for everyone. I designed the program in such a way to say, look, it costs less to eat a plant-based diet. This is really a third world diet. You need a pair of walking shoes, yoga mat, although you don't really even need that, and to spend more time with your friends and family. None of these things cost anything. If anything, they cost less. But I knew that it's hard for many people to do these things without some support, at least initially. And so now that Medicare has been covering it, it's been great. And then when COVID hit, if anything good came out of COVID, it was learning that we could do this virtually as well as doing it in person. And so that enabled us to reach people wherever they live, not just if they had driving distance, within driving distance from the hospitals or clinics we trained. So that helped, when people who couldn't take off work or get childcare or didn't have a car or whatever could do it in the comfort of their own home. We're hoping that they'll eventually cover this for Alzheimer's as well, but we'll see. But I'm really grateful to the people at Medicare for doing that.
Yeah. Well, I'm 54 days away from Medicare, so I can't, that is fantastic. So, Dr. Ornish, a lot of people in the chat are asking if you could talk a little bit about your Alzheimer's study.
Sure. So we did a randomized controlled trial in collaboration with the heads of neurology at Harvard and Mass General, as well as neurologists at UC San Diego, UCSF, Duke, the Carroll Institute, and others, and Renown. And we found that after 20 weeks, people who had early stage Alzheimer's disease, who made the same lifestyle changes that we found could reverse all these other conditions. In other words, it's the same program that's described in the Undo It book, even though I didn't talk about Alzheimer's very much in there because we hadn't done the study yet when we published it. But we found that there were using 4 standard measures of cognition and function that are used in the FDA drug trials. We found that overall 71% of the patients were able to stop or reverse the progression of their Alzheimer's disease. In other words, their ability to think got better, at least stayed the same or got better, whereas 68% of the control group patients got worse. And 3 of the 4 measures showed improvement in the intervention group. 1 was essentially unchanged, slightly worse, whereas all 4 measures worsened in the randomized control group. So there have been billions of dollars have been spent in the last 20 years to treat Alzheimer's, and only 3 have been approved by the FDA, all within the last few years. And all they do is slow down the rate at which you get worse slightly. But getting worse more slowly, it goes back to what we talked about earlier in this conversation, AJ, about hope and meaning. But if you tell somebody you're only going to get worse, it almost becomes self-fulfilling. You take someone's hope away, and then you take their car away and they can't drive, and it's just their world starts to shrink. We're finding that we can give people this, and by the way, the suicide rate within a month of being diagnosed with Alzheimer's disease is about 7 times higher because, again, they take your hope away and then nobody wants to be a burden. So we can show that, again, without guaranteeing, not everybody got better, but we did find that same dose response correlation. The more people followed our program, the more likely they were to show improvement and to the degree of improvement. But also, the more likely we showed improvements in what's called the A beta 42/40 ratio, which is a measure of amyloid. And amyloid is the protein that kind of gunks up your brain. And the drugs work by pulling amyloid out of your brain. We found the lifestyle changes did the same thing, but without the side effects of bleeding into your brain or brain swelling or things like that, at a fraction of the cost, and the only side effects are good ones. So we'll be looking at a longer term version of this over 40 weeks. But right now we're able to say, with real science that many people who have early stage Alzheimer's can slow, stop, or even reverse the progression of their disease by making these same lifestyle changes. And that can be fulfilling in a good way because we can give people a sense of hope. Again, not everybody gets better, but most people do. So unlike the drugs where they're expensive and have terrible side effects, this costs essentially nothing, the price of a $15 book maybe, and the side effects are good ones. So of all the work we've done, I think in some ways it's the most meaningful to me personally. First of all, my mom died of Alzheimer's and I have one of the genes for it, but also because nothing else works, at least with heart disease or other things. There are other things that work, but really nothing does with Alzheimer's. So we're giving many people new hope and new choices that they didn't have before.
Why don't they do it? When I think about this book was written over 30 years ago. You were on the cover of Time magazine. It doesn't just reverse heart disease, it largely prevents it. And the same might be said for Alzheimer's. So why do people wait so long to make a
Well,
change?
well, a lot of people didn't like some of the new AI tests can diagnose Alzheimer's up to 10 years before it becomes clinically apparent. But a lot of people say, why would I want to know if I'm likely to get this horrible disease if I can't do anything about it? When you lose your memories, you lose everything. Why would I want to know? My brother, for example, doesn't even want to know his ApoE4 testing because, it's like, why would I want to know if I'm at risk for it if I can't do anything about it? But if we can stop or reverse its progression, then it probably works even better to prevent it. And everybody agrees that the earlier you intervene with Alzheimer's, the more likely it is to be effective. And so now we can tell people, look, it's good to know whether you're at risk for it because now you can do that might motivate you to do something about it that could help prevent it or at very least delay it and hopefully prevent it completely. So And it'll also help your heart and all these other, because it's the same lifestyle changes for all these different conditions because they all share the same underlying biological mechanisms.
Yeah. There's a question about fish oil. When you recommend it, could a person get the same effect or result if they use, say, a vegan DHA, or does it have to be fish
Absolutely.
oil?
No, no, it can be vegan. The fish get it from eating the algae, so you're just going to the primary source by doing that. And I
Great.
also want to emphasize too that the difference between curing and healing, we curing is like your disease physically getting better. And we often see people, we don't use the word curing, but they certainly we use the word reversing the progression. In other words, instead of getting worse and worse, they're starting to get better and better. I try to avoid the word curing, but healing is can occur even when people's disease gets worse, even when they die from it. Healing in the sense of the heart opening, the rediscovering of inner sources of peace and joy and well-being, having non-dual experiences, whether assisted by psychedelics or meditation or counseling or whatever spiritual path you have, will ultimately take you to that same place. And on one level, we're separate, on another level, we're not. And so to me, those are really the most important questions. And that when we work at that level, we find the other things tend to follow in good directions as well.
That's great. And somebody's asking if you can talk about what's the difference between a diagnosis of dementia and Alzheimer's. Are they similar? Are they the same?
Alzheimer's is one type of dementia, but there are others like vascular dementia and other things like that. It's the most common cause, but it's one of many forms. Dementia just means you're not thinking very well.
Great. Thank you. And I have one more question for you, Dr. Ornish, and that is if you could send a message of hope or share with somebody currently facing a cancer diagnosis, what would that message be?
Well, the hope is that there's a certain element of mystery to all of this. And just because, some studies that your doctor quotes may tell you you've got X months or years to live, that may or may not be true. It may be that you're more likely to die sooner, but it doesn't mean it's a death sentence. And in most cases, there are always exceptions. And so I never give up that sense of hope. But also, I think it's important to use that experience without in any way trivializing or minimizing how horrible it is, to say, where can I find something? Where's the pony in there? Where can I find something that will make this meaningful, that will allow me to bear this suffering? Is there anything good that can come out of this in terms of all the things we've talked about that having a diagnosis like that can be so clarifying? And to realize that when we get in those dark places, to reach out to our friends and family. This is the time to lean on your friends. The light really does, one small candle can drive out, a lot of darkness. And so if we can look for those things that really nurture and sustain us, not just physically, but emotionally and spiritually and all the different aspects of ourselves, then we can find meaning in that, which in turn can also be self-fulfilling in a good way.
And that's exactly what I'm doing. Like Viktor Frankl, I'm finding meaning in my cancer and I'm not allowing my diagnosis to be my destiny.
Well said.
Dr. Ornish, thank you so very much. And thank you for all your work.
You too. Take care.
And I thank you. And thanks all of you for watching day 6 of Thriving in the Face of Cancer. I want you to know wherever you are in your cancer journey, as long as you're still breathing, I believe there's hope and that you too can thrive even in the face of cancer. Please tune in tomorrow at 11 a.m. Pacific time for day 7 of Thriving in the Face of Cancer with Dr. Doug Lisle, who'll be talking about how to manage anxiety in general.